often. I'm sure you've heard it called Obamacare. For me, those names are interchangeable. You can use whatever you want as far as I'm concerned. But it's important to know that the law is actually called the Patient and Protection and Affordable Care Act. You can use any shorthand you want. You'll hear me often say the ACA, which is, of course, just an acronym for Affordable Care Act. So this is health insurance reform. So often people say it's health care reform, and it's really, really important to emphasize that there is very little that's being reformed in terms of care, but it's actually insurance provisions that are being changed. So a lot of protections are being put in place for insurance, and then we're also expanding opportunities for people to access insurance. And this law has actually been in effect for 3 years, which is why so much has really happened. I know that there's a lot of coverage in the news right now about the Affordable Care Act and everything that's happening and the government shutdown, et cetera, but honestly, there's been a lot that's already in place. So we're going to talk through that very briefly. And then, as I said, we're going to go through the 2 main stages. The first stage that's happened for the last 3 years of patient protection, and then the second stage of expanding coverage. All right, so, but why, right? Why are you here today? Why does it matter? Well, one thing is that there are some opportunities for small employers in particular. There's an opportunity potentially that you might qualify for financial support if you choose to offer insurance to your employees, so we'll talk through that. There are also penalties for large employers, so if you work for or know of companies that are large employers, that's 50 or more employees, and we'll talk through that and what sort of penalties they will pay if they choose to not offer coverage for their employees. And then also, as small business owners, I know that you all care very much about your employees, and by offering them insurance coverage, there's a major reduction in their health and financial risk that they have to take on. And it also reduces the risk for their clients. You know, if you have healthy employees, they're not going to, they're going to be well and be able to take care of your clients well, and your business will do better. Also, there's a reduction in lost work time. There's been plenty of studies that those who have insurance tend to be healthier overall and are able to be at work more consistently and take less sick leave. And you'll have more employee stability and health long term. And lastly, this is really a key thing here, and that's one of the reasons that there are tax credits for small businesses, is to allow small businesses to compete with large businesses by offering insurance to their employees. With the last one?
Yeah.
So we have a question here. Is there a definition of employee, such as how many hours they work? We have a lot of part-time employees. Great question. I promise we will get to that. All right. So uninsured in Wisconsin. We're going to cruise through this a little bit. This is the federal poverty levels here. So you're going to hear me say the words FPL. That's not even a word. It's 3 letters, and it stands for federal poverty level, and it's a shorthand that we use often to talk about income. So these are all yearly incomes, adjusted gross income. So take a look at this and try to figure out your family, just as an example. So if there are 3 people in your family, you would go down to group size 3. And, depending on how much income your entire family makes. So if you have a partner, you would add together your total income and determine where you fall. So let's say you and your partner combined make $52,000 a year. You know then that you fall, maybe around 260% of the federal poverty level. So just start to get an idea there about what's accurate and where you fall, and you might have an idea of where your employees fall. So, maybe you have single employees that are making, $18,000 a year or $24,000 a year. You can start to understand where they fall in this spectrum. All right, so uninsured, there's almost 400,000 uninsured folks that are non-elderly, so not eligible for Medicare in Wisconsin alone. So this is just Wisconsin. That's quite a few. And I think that none of you would be surprised to know that many are child care providers. Obviously not 400,000 of them, but the proportion of child care providers that are uninsured is higher than many other professions. And I think that we can all play a role in hopefully someday changing those statistics. And there's also 55,000 uninsured kids, I'm sorry to say. And of course we know that kids really, really need and deserve access to quality health care in order to grow up healthy. There's been, again, a lot of studies to show that access to well child visits and having a provider in their lives early on can have a huge impact on their long-term health and well-being. And not surprisingly, many of these 400,000 are actually working. So 62% of those who are uninsured in Wisconsin are working, okay? They're also commonly in rural areas. So sometimes people think that being uninsured is an urban problem. As you'll see here, the darker the color, the higher the percentage per capita of uninsured folks. And this really starts to be a rural problem as well. So this is really, really important, particularly outstate. Okay, so very quickly, what has already happened? What happened in the last 3 years that we should know about moving forward? So first, the Affordable Care Act outlawed insurance denials based on pre-existing conditions. So for the last 3 years, before 2014, that has been true for kids. So right away the law went into effect and they said never more can an insurance company deny a kid, a child, health insurance for having a pre-existing condition. So there are over 300,000 children in Wisconsin alone who have pre-existing conditions. So for the last 3 years that's been an incredible, incredible benefit to kids. And it's now a benefit that's being extended to all adults. So starting on January 1st of 2014, nobody can be denied insurance due to a pre-existing condition. In the past, anybody, they could deny you for having been in a domestic dispute or domestic violence. They could deny you for having a complicated pregnancy or an immune disorder or HIV or many, many, many things. That is no longer legal. And we'll talk about how they're able to make those decisions moving forward. Young adults, this one's been in the press a lot. Young adults can stay on their parents' policies until they're 26. So this is true for those who are accessing insurance either through the private market or through their employers. So for individuals who are on government care like Medicaid, BadgerCare, or Medicare, that doesn't apply to them, okay? All right, also the Affordable Care Act has eliminated lifetime limits and annual limits. So we talked about this a little bit on Monday, but this is really, really critical. You know, as people who care very much about children, you probably know that there are some children who are born premature who spend several days in the NICU in intensive care and hit their lifetime limit. Previously, when this was legal, they hit their lifetime limit in the first 10 days of their life. And you can imagine what that would do to them moving forward. So that's a really, really important patient protection. Also, insurance has to spend 80% of the money that we give them on medical care, as opposed to overhead and administrative costs and you know, bonuses to stockholders, et cetera. So if they don't do that, they are required to send rebates to their insurees. Also, double-digit premium increases. So anything that's 10% or more in your premium has to be reviewed by the state, the Officer of Commissioner of Insurance, and they have to approve it. So if previously an insurance company could say, hey, we're going to up your premium by 20% or 30% or 15%, and they could just do that, right? And you would be stuck paying that or choosing to cancel your insurance. Now they have to prove that those costs are necessary. Also, for the last 3 years, there have been small business tax credits. So if you are a small business in the last 3 years and you have been offering insurance to your employees already, it's possible that you qualify for a tax credit. If you haven't been receiving that tax credit, you can amend your tax return and get that back. Okay, so that's just that's an important note there. So that's a good kind of tax tip. So think about the last 3 years. If you've been offering insurance, make sure you look into that. Also, moving forward, preventative care services are offered without a copay. So these are things like mammographies, colonoscopies, contraceptive care, smoking cessation, etc. All of those things are now offered without any payment by the patient. Really, really big deal. There's an incredible emphasis here on trying to get people healthy and keep them there, rather than allowing them to get very, very sick and paying the cost of very sick population. And lastly, I'll just say that there are no major changes to Medicare. So probably many of you have, either you are on Medicare, or you know people on Medicare, or you work with clients who are on Medicare, you have family members on Medicare. Please spread the word, okay? There's a lot of mythology going around about Medicare right now. Please, 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 just let them know that their Medicare is essentially unchanged. The main difference for Medicare enrollees is that there's some improvements so that they don't have to spend as much money on prescription drugs, and they don't have to pay for preventative care, just like the one above this. So that's an incredible improvement. All right, so let's get into the juicy stuff here. So individual mandate and marketplace. Please feel free to ask questions if I start going too quickly. There's a question here about how seasonal employees are addressed in the law. We can talk about that. We'll get there kind of, but I don't go too far into that. There's a way that they calculate whether or not you count seasonal employees. So there's kind of you can do a little bit of math to determine that, and I'm happy to send you some resources on that. Okay, so individual mandate begins in 2014. So starting in 2014, starting January 1st, it's generally expected that everybody who lives in the United States who is a citizen, so who's here legally, is required to have insurance. Okay, if they do not have insurance, when they file their taxes for the following year, they will have to pay a penalty, except there are many, many exemptions. Okay, so if you fall into any of these categories, if you know people fall into these categories, such as if your income is so low that you're not required to file taxes, then you're not subject to the penalty. If you had a coverage gap of only 3 months or less, then you are not subject to the penalty. Okay? So even if you don't have insurance now, but you get insurance before April 1st, you will not pay a penalty in this first year. Okay? So also similarly, if you are part of a federally recognized tribe, if you are incarcerated, if you're not lawfully present, etc. There are all sorts of exemptions to this rule, and it's possible that you fall into one of those categories. If you do not, this first year you should expect to pay either $95 per adult or half of that for a kid, any of your dependent children, or 1% of your taxable income. So whichever one is higher, okay? So if, for instance, you were to make $50,000, your taxable income is $40,000 because if you're a single person, they don't count the first $10,000. If you're a family, they don't count the first $20,000. So that means you'd have $40,000 of taxable income, so 1% of $40,000 is $400. So if you made $50,000 and you were a single person in 2014 and you didn't have insurance for the entire year, you would pay, when you file your taxes, a fee of $400 for not having insurance. Okay? And then that doubles in 2015. It goes up again in 2016, and then after that time it starts to adjust over time for the cost of living, just for inflation. Okay, so the individual mandate, why do we have that? Obviously the individual mandate's not super popular. People don't love to be told what they need to buy or being punished and have to pay more money if they don't buy it. Well, there's some reasons that we need that. All of the patient protections that you heard in a few slides ago, that there's no lifetime limits anymore, and they can't deny you if you have a pre-existing condition, right? And all preventative services are free. We would have never gotten those protections if we didn't also expand the pool of insurees, right? Everybody needs to be participating and paying a small amount in order to spread the risk across a population. Otherwise, insurance companies would have gone under immediately, and there'd be no hope. So that's why everybody's required to have insurance, so we can have those patient protections. And in order to allow everybody to have insurance, they did a few things. So what came with that pre-existing condition exclusion being outlawed for everybody, they made it so that insurers could only determine your premium based on a few things. So it used to be the case that women paid more than men for their insurance, even when it did not include maternity care. Often maternity care was not included. It was a separate rider. Women would still pay more than men just for being women. Okay? Moving forward, they can't do that. That was called gender rating. Moving forward, they can only affect your rate. They can only determine your premium based on your age, your location, and whether or not you smoke. For age, it used to be the case that older people could pay 5 to 10 or more times the amount as younger people. Moving forward, it's only allowed to be 3 times more. Okay? So an older person can only pay a maximum of 3 times more than a younger person. So that means older people are going to pay less than they used to, and younger people are going to pay more than they used to. But of course, those younger people will someday be older people and someday benefit from that. And location, the reason they're allowed to change your premium based on where you live is because costs of medical services change depending on your location, right? The amount that something costs in Milwaukee is different than what it might cost in Rhinelander, okay? Also, your smoking status, obviously there's a lot of research linking smoking to a variety of kind of expensive health impacts like obesity and heart disease, among others. So if you are a smoker, there are some insurers who charge almost twice as much for your monthly premium amount, okay? I'm not in this webinar defining all these terms, premium and copay and coinsurance. Feel free to ask questions in your question box about those if you don't know what those terms mean, or you can go, obviously you can Google them, or I described them in detail on the Monday webinar. If you are a smoker and you don't want to pay that additional premium amount, you can sign up for a smoking cessation program, and if you complete it, you will not be required to pay that additional premium. So the individual mandate also occurred in tandem with an expansion of Medicaid. In Wisconsin, Medicaid is mostly called BadgerCare or BadgerCare Plus. So in Wisconsin, we chose, our elected leaders, the governor and some state officials, chose not to take on the additional Medicaid eligibility. So in Wisconsin, we are moving parents and caretakers, many parents and caretakers off of BadgerCare, and they're supposed to move into the marketplace, which we'll talk about. And we're opening up BadgerCare to childless adults up to 100% of the federal poverty level. And it's possible that you might have employees who fall into this category. So if you remember the FPL chart before, you can check that out. For a single person, 100% federal poverty level is about $11,000 a year and $500. Okay, so that's for a single person. So if somebody makes less than that, they could qualify for BadgerCare. We're not going to talk about BadgerCare much today. So again, if you're interested in that, feel free to check out Monday's webinar. We will talk quite a bit about the creation of the competitive health insurance marketplace. So with the marketplace, there are tax credits for individuals, and there's cost sharing. So this is how they're helping people afford coverage. So they're saying, okay, if we're going to require you to have coverage, we need to make it affordable. For those who are very low income, we're going to put you on Medicaid. For those who are slightly, middle or higher income, we're going to make a marketplace available so you can check out rates. And for those who fall kind of middle income range, lower income, we're going to have some financial assistance available on the marketplace. Okay, so this is particularly important for small businesses. Moving forward, this is new with the Affordable Care Act. Moving forward, all insurance plans offered for small businesses and the individual market have to include all of these benefits, okay? So this did not used to be the case. So previously, a plan could just choose not to cover, certain substance use disorders, or they could choose to have maternity care as a separate rider. So moving forward, everybody is going to be required to pay for these things. So that means, yes, older women and men are going to be paying for maternity care. Okay, the reason I bring that up is because I usually get a lot of questions about that one, and my only response is that women don't make babies alone. Okay, so that's the intention here, is that we should all be sharing the cost of the baby making. So we're all going to pay for maternity care moving forward. So this is our default plan. If you're interested in what the kind of minimum plan has to look like in Wisconsin, you can look up the United Healthcare Choice Plus plan. That's the minimum plan. So moving forward, all insurance plans that are offered for small businesses are going to include all these things, as are Medicaid benefits. Okay? This does not apply to large group employers at this time. Okay? All right, and one other thing, this was in the news quite a lot. President Obama, kind of when the law came out, he said repeatedly that if you like your plan, you can keep it. Unfortunately, the way things shook out is that insurers started sending out cancellation notices because plans did not meet these requirements. But to try to better keep his promise, Obama has put out a regulation that says any insurers who are willing to continue offering the plans that they offered before, those customers can continue to have access to those plans for 2014. So this is kind of a rare problem in Wisconsin. Very few actually got cancellation notices in Wisconsin. Most people renewed their plan before the new year. So hopefully you didn't see a cancellation notice. But I'd be interested to know if you had any issues with this as a small business. All right, so the creation of a marketplace, why? All right, so the marketplace is meant to act as sort of a, like a kayak.com or Expedia, something like that, where you're able to search for things and compare them very easily. So in the same way that kayak.com pulls together all the information, all the flight and price information for a bunch of different companies, that's what the marketplace does, okay? So there's no plan called Obamacare. When you go on to healthcare.gov, which is the marketplace, okay, when you go on to healthcare.gov, you're going to see the same insurance providers that you know of in your communities now. So like Physicians Plus or Dean Healthcare or Group Health Cooperative or whatever it might be in your area. Those are the insurers that are offering plans on the marketplace, okay? So they created one for the individual mandate, or for individuals, all right? So anybody who does not get insurance through their employer and is not eligible for Medicaid can go to healthcare.gov as an individual and have more purchasing power because they're grouping all the individuals together, okay? They created a separate one for small businesses called the shop, and we're going to talk a little bit about that. Part of the point of this is that we achieve efficiencies and lower costs by pooling a lot of groups together. So previously, small businesses had a really hard time getting good prices on insurance because they were small. Whereas large employers, when you're walking, when you go talk to an insurance company and you have 5,000 employees, you have more negotiating power, right? You're able to cut a better deal. So the point here is to pull a bunch of small businesses together to allow some cost containment, okay? And also, this is how most people actually access financial assistance. There's financial assistance available for individuals who go here, who qualify, and there's also some financial assistance in the form of a tax credit for small businesses who qualify, and we'll talk about which businesses qualify for that. Also, as I said, the intention here is to provide an apples-to-apples comparison. So it used to be the case that insurance companies wrote their plans any way they wanted, and they were almost unreadable. I mean, very, very, very hard to understand for the average person. And moving forward, there's a standardized, easy to understand way that they're mandated to write up what the plan covers, when it covers it, and with which providers and hospitals and clinics. Okay, so it's going to be much easier to understand. There are 4 metal tiers that all the plans are grouped in, and we'll talk about that in just a second. And just to end here on this, this is, people kind of just think this is interesting. Usually members of Congress, our elected officials out in Washington, are required to purchase their health coverage through the marketplace. Marketplace and exchange are the same thing here, okay? They're the same word used interchangeably. So the point of this simply is that we're hoping that this makes them have some sort of interest in making this work well. All right, so here are our precious metal tiers. So they kind of look like the Olympic levels here. They start out at bronze, this is the lowest level, and they go all the way up to platinum. So bronze has an actuarial value of 60%, okay? So that means it's expected to cover 60% of the cost of benefits on average. So that means for the entire pool of individuals who are on that plan is expected to cover 60% of their medical costs, okay? And 40% of their medical costs will be covered by that population. So that doesn't mean that the money you give them, they're going to pay 60% of that money for your medical costs. That means across the population. So if you're somebody who just goes to the doctor for preventative care mostly, then they might cover, 90, 95% of your costs. But if you're somebody who spends a lot of time in the hospital and needs a lot of care, they might only cover 40% of your costs. Okay, so it's just an average across that population. And as you go up here, your premium, your monthly premium increases. So from bronze to platinum, your premium increases every month, but your out-of-pocket costs, like your copay and your coinsurance and your deductible, decrease as you go up. Okay, so if you're somebody who needs a lot of care and tends to go to the doctor a lot, you might want to be looking up here in this gold and platinum area. And any insurer who chose to participate in the exchange or the marketplace who wants to offer plans on healthcare.gov is required to offer both a gold plan and a silver plan. Okay? They can decide if they want to offer a bronze or a platinum, but they're required to offer at least one of each of these. I also wanted to point out that for some folks, so for those under 30 years old, and some who fall into that exemption from the individual mandate, so though, if somebody has a hardship exemption from the individual mandate, it is not required to have insurance, they can also qualify for a catastrophic plan. And that just means it has a very, very, very high deductible. So it's only for if you have a crisis event. So for instance, if you suddenly get diagnosed with cancer, which, let's hope that that doesn't happen, and you have a catastrophic plan, you might have a deductible of $5,000, and that means you would pay $5,000 in medical costs before this plan would kick in. However, catastrophic plans are now required to include preventative services for free. And that's really important for this population under 30. We know that this population often is lower income and going through transition, so they are eligible for these catastrophic plans as well. And we want these guys to have preventative care because we want them to age gracefully, right? So that's why that's free. I want to point out a couple things. One, the silver plan we're going to circle back to in just a moment to talk about who is, this is going to be important when we talk about financial assistance for individuals on the marketplace. And secondly, I want to point out the bronze plan. This is the base level, okay? Moving forward, essentially, the Obama administration has said this is the minimum amount that we want covered at least for people's insurance, okay? So if you were to have an insurance plan that only covered the actuarial value of 50% or 35%, they would not consider that to be minimum essential coverage. And we're going to circle back to that term, minimum essential coverage, in a minute, but I want you to notice this bronze plan here. All right, so there's two types of financial assistance, and this is for individuals on the marketplace. And the reason I'm telling you about this is because you as employers and you as directors and you working in human resources are going to need to know this information, and I'm going to show you a form that you're going to be asked to filled out for any employees who go into the marketplace. All right, so the first thing is this premium tax credit is designed to reduce the monthly premium amount for low to middle income folks. Okay, so not your out-of-pocket costs, not your copay deductible, but your monthly premium. You can only get a premium tax credit as an individual in the marketplace. Okay, so you can't get it any other way. You have to get your insurance through the marketplace. This is really important. In order to qualify for a premium tax credit, you must be ineligible for government-sponsored insurance, which means you can't be eligible for BadgerCare, Medicaid, Medicare, Veterans Care, TRICARE, any of those things, okay? And you have to be ineligible for what's deemed affordable and adequate employer-sponsored insurance. Okay, we're going to talk about those terms because this is where you guys are going to come into play. This is really, really important for you all to know. All right, and this premium tax credit is available for those who fall between 100% federal poverty level and 400% federal poverty level. There are two ways to receive this credit, or you can kind of do a combination of the two. You can have a monthly amount mailed to your insurance provider to reduce your premium payment, or you can choose to receive your entire subsidy as a tax credit when you file your taxes at the end of the year. Okay, so the way this works essentially is, let's say you go on to the marketplace and you put in your income, and the marketplace determines that you fall at 200% of the federal poverty level. Maybe it says, okay, you qualify for $400 per month in premium tax credit. From there, you can decide, okay, if I qualify for $400 a month, I want to apply $300 of that to my monthly amount, and then they will mail $300 to your insurer, and then your premium every month is reduced by $300. Anything more than that, you would get the rest of that at the end of the year when you file your taxes. So what's nice about that is it gives you some room to determine what's best for you, whether you want to get it as a lump sum at the end of the year or whether you want the relief every month. The only issue here to think about is if you choose to get your entire premium subsidy every month and your income changes dramatically over the year, like let's say you tell the marketplace you're going to make $30,000 and you end up making $60,000, you might have to pay some of that amount back when you file your taxes. Okay, and this is the second kind of financial relief. There's only two in the marketplace. So the first one was for your monthly premium. So that's just so you can afford the insurance. But then they also wanted to make sure we don't just want you to have insurance, we want you to be able to use the insurance, right? So we wanted to lower the cost of your co-pays, your co-insurance, and your deductibles, okay? So this, again, must be used in the marketplace. You can only get this assistance in the marketplace. Again, you have to be ineligible for BadgerCare, Medicare. You also cannot have an offer of affordable and adequate employer-sponsored insurance. And this is for a slightly lower income bracket. So instead of going up to 400% of the federal poverty level, it goes to 250% of the federal poverty level. So those who fall between 100 and 250% of the federal poverty level have access both to the cost-sharing assistance and to the premium assistance. However, you'll see this here, and that's why I wanted to point out that silver plan, because if you are somebody who falls between 100 and 250% of the federal poverty level, you want to make sure that you're on a silver level plan. You can only get this assistance if you're on a silver plan. You cannot get this cost sharing on a bronze plan, a gold plan, or a platinum plan. So that's why that silver plan is really important to think about if you fall in this income bracket. All right, so what do they mean by affordable? This is where you as employers really start to have to think about some tricky stuff, okay? So this is not something that most people understand. This is kind of specific for you guys. So we can feel free to ask questions about this because it can be a little tricky. We're going to try to talk through it. So they define affordable as the premium for an employee-only plan must cost less than 9.5% of a family's income. So what's tricky about that is the only way they deem affordable, okay, whether they're talking about a family plan or an individual plan, Affordable is only determined based on the employee-only plan, okay? However, it's based on a family's income instead of just that employee's income, okay? So that can be a little tricky to think about. How do they define adequate, all right? So again, this is where that bronze level plan comes into play. They decided that the minimum coverage has to have cover at least 60% of total costs. So this just means they want everybody to have at least a bronze level plan. So that's what adequate is, and this is what affordable means. So large employers are required to offer coverage that's deemed both affordable and adequate, or they face a fine, and we'll get more to that, okay? What's important for small businesses is to know if you do offer coverage, is it affordable and adequate? Because you're going to have to fill out a form for employees who go through the marketplace and try to access financial assistance. Okay, so all family members who are offered affordable and adequate coverage through an employer are deemed ineligible for financial assistance on the marketplace. What does that mean? Okay, so this is another tricky one. So essentially this means if you as an employer offer family coverage to both spouses and children, the spouse and the children are not eligible for the financial assistance, the premium subsidy or the cost sharing assistance, if that coverage is affordable and adequate, okay? But if you do not offer coverage for any of those groups, like the spouse or the children, then whoever does not offer coverage is eligible. So just a couple examples here. Here's Lisa. She works for an employer who offers affordable and comprehensive coverage, and they're very generous. They offer it to her, they offer it to her spouse, and they offer it to both of their kids. That means nobody in Lisa's family is going to be eligible for the premium tax credit or the cost sharing assistance. Okay, but here's Mark. Mark works for an employer who offers affordable and comprehensive coverage only to Jenna. So they only have spousal coverage. They don't have family coverage. So it's not offered to their son, Dan. That means that Dan, since he doesn't have an offer of coverage, is eligible for cost sharing and premium tax credit assistance. Okay? All right, here's where it kind of brass tacks here. So this is a form right here that you might start to see, okay? I want you to just get familiar with it. You can Google employer coverage tool. You can Google, ACA employer coverage tool, and you should be able to find this form. It's just this one front page form. It's called employer coverage tool, and you're going to have some pieces you have to fill out in here, like your name and the name of the company, the address of the company, phone number, etc. You're going to have to know which members of your employee's family are eligible for coverage. Why is that? Because of what we just talked about, right? Because they need to know who is offered coverage in the family so they know who is not eligible for financial assistance. They also want to know, does the health plan you offer meet that minimum value, that 60% bronze level? And they want to know how much the employee's premium is for an employee-only plan, because they also need to assess whether or not the coverage that you offer is affordable. So you might start seeing these forms. Just to give you a closer look here, this is the first part of the employer information. So, employer identification number, who can we contact, phone number, email address, so some basic information. And then they say, is the employee currently eligible for coverage offered by this employer? Or will the employee be eligible in the next 3 months? So if you have kind of a waiting period and you just hired somebody, they want to know, are they going to get coverage soon? And if you say, no, we don't offer coverage, you're just done with the form. You hand it back to the employee, and they can send it in, and you're done. If you say yes, if the employee is not eligible right now, when are they going to be eligible? And you have to fill out this last part, which is, does the employer offer a health plan that covers an employee's spouse or dependents? And you need to mark which, if any, or both, that the plan is offered to. So if you offer a family coverage, you got to check spouse and dependents, etc. Okay? Then they're going to ask, does the employer offer a health plan that meets that minimum value standard? So that's that 60% bronze level. So down here you see the employer-sponsored health plan meets the minimum value standard if the plan share of the total allowed benefits cost covered by the plan is no less than 60% of such costs. And then they list what looks like Russian down here. Okay, most of you, if you offer coverage, you should be able to call your insurer and talk to your broker or agent and track down that information if you don't know it now. And then they're going to ask for the lowest cost plan, okay, lowest cost plan that meets that standard, that 60% standard, offered only to the employee, not family plans. If the employer has wellness programs, provide the premium that the employee would pay if he or she received the maximum discount, okay? So that means they're not paying that tobacco surcharge or anything like that, and they didn't receive any other discounts, okay, for wellness programs. How much would the employee have to pay in premiums for this plan, and how often? And why are they asking this again? Obviously, it's for the affordability question. So this is to determine, are they offered adequate coverage? This is to determine, are they offered affordable coverage? And then what change will the employer make for the new plan year? Okay, so moving forward, they want to know what you're going to do and what changes they're going to see. And that's the entirety of the form. I just want you to become familiar with that because you're probably going to start seeing those sometime soon if you haven't already. All right, so we already got a question about this. For those of you who are self-employed, what's up? What do I need to know? All right, so self-employed means you own an income-generating business, but you have no employees. And just one note here is that independent contractors do not count as employees. You can have as many contractors as you want, and they're still not employees. Okay, that means it's just you. Once you hire one person, if it's two of you, you become a small business. If you are self-employed, you do not use the shop. Okay, you use the individual marketplace. You go to healthcare.gov, and depending on your income, just like everybody else, you could get financial assistance. Okay? Again, not eligible for the shop. You're not eligible to use the small business exchange. Okay? And this is just a good thing to note. As somebody who's self-employed, there are special income calculations, and I will send a sheet to Andrea here that she can post on the site that has some of the information about how income is counted. Certain self-employed income is disregarded for what's called MAGI right there, and that's the new income determination method that they're going to use. Okay? All right, so moving forward, let's just pause here for a moment and just see if we have any questions about the individual mandate and the marketplace and anything like that. Any questions happening there? I know many of you weren't on the Monday thing, and we cruised right on through that. All right, cool. Okay, well, feel free again to type questions as I'm talking if something occurs to you. Okay, here's one. How does the government know if you have private insurance when determining your tax penalty at the end of the year? Good question. So when you file your taxes at the end of the year, there's a new question on your tax form that asks you, did you have insurance this year? And if you did, how many months of the year did you have insurance? And so you're going to say, okay, yeah, I had insurance, 6 months this year. And that means that you get a 3-month disregard, okay? So that means we're technically required to have insurance 9 months of the year. So if you had insurance for 6 months, you will not pay a penalty for those, or you would only pay a penalty for 3 months of the year. So the penalty is prorated for the number of months without coverage. And the way that they verify that is they also ask employers to report they ask employers and insurers to report who has insurance, who their clients are. Okay? So they ask employers to report what they offered in coverage, and then they ask insurers to report who had coverage and when. And they're, of course, creating giant databases to check all this information. Okay? Another question, if you are self-employed, are there any stipulations for being eligible for BadgerCare versus the marketplace? Great question. No. So that's completely depending on your income. So if you're an adult and you fall below 100% of the federal poverty level, then you will be eligible for BadgerCare. If you are above 100% of the federal poverty level, then you can go onto the marketplace. Okay, so it's just about your income. It has nothing to do with anything else. Okay, and If you're a pregnant woman or a child, you're eligible up to 300% for BadgerCare. Another question here, do we have to send in proof of insurance at the time of taxes? So that's a good question, and I don't have a good answer for that yet. I don't know that the IRS has released rules about that. I'm going to write that question down and get back to you and try to get back to Andrea for an answer to that. I don't know if they've released every single day. I read new rules and regulations that help to explain the many, many nuances of the law. So I haven't read anything yet as to what proof you're going to have to demonstrate. Just writing your question down here. Okay, and then what tab on your website is the form that states what counts as income for self-employed on the last slide? What tab on your website is the form that states what counts as income for self? So I don't have a slide showing exactly what counts as income for self-employed individuals. I'm going to send that to Andrea, and hopefully that's going to be helpful. So I'm sorry, that's a resource that's going to come later, but I promise that you'll get it.
CCS website?
We don't have that posted.
I don't think that's on the WICA website.
No, I'm going to get it to you.
Okay.
Yeah. So the place that I have a question here. What were the initials? And I think you're talking about where I work. So I work at the Wisconsin Council on Children and Families, and the website is wccs.org. All right, we're going to move on here. Feel free to continue asking questions. I will answer them as best I can as we're going on here. All right, somebody asked me to go back one slide. Oh, were you looking for MAGI? M-A-G-I. So that's Modified Adjusted Gross Income. You can Google MAGI and self-employed, and you should find a resource that's from Berkeley. And it's a one-page resource from Berkeley, and it has some good information. All right, here we go. We're going to move on, and we're going to talk more specifically about what's up for small businesses and what's up for large businesses. What sort of opportunities do you have here? All right, so to put it very simply, this is an oversimplification, but small businesses get a carrot, large businesses get a stick, okay? Small businesses are not required, I repeat, not required to offer insurance to their employees, but they get some help if they qualify. They get some help for doing it if they do it, and they open the shop exchange to try to make it easier for them to get insurance and more affordable. Large businesses, on the other hand, and I'm going to define these things, large businesses, if they do not offer affordable and adequate coverage, they're going to be fined when they file their taxes at the end of the year. All right, so here we go. Small businesses, you get more options for your employees. All right, so option one, just don't offer insurance, okay? If you don't offer insurance now, you don't have to offer insurance. There's no penalty or fees if you have fewer than 50 full-time equivalent employees. And a full-time equivalent employee for this, to determine whether or not you have to pay a fine, is considered 30 hours a week. All right? So if you have 2 employees that work 15 hours a week, that's considered 1 full-time equivalent employee. Okay? All right. Option 2, stay with your current health insurance. So if you already offer health insurance, awesome. That's very, very good. And if you like it, you just hang on to it. You don't do anything at all. You will want to just make sure that that the insurance includes all of the essential health benefits. But I'm sure if you offer insurance already, you will have been contacted by your insurer if they needed to change the benefit structure to adhere to those guidelines. All right, and so the new option here is option 3. You can offer health insurance through the new shop marketplace. So let's learn about that. What is the shop marketplace exchange? I'm sorry, those are the same words once again. Okay, shop, just like everything else in government, is an acronym. SHOP means Small Business Health Options Program, but everybody just calls it SHOP Marketplace. All right, so much like the marketplace that's available for individuals, it's an online health insurance portal that small businesses can use to compare and contrast plans. And as we discussed, all of the plans that are offered on the marketplace and the plans that are offered to small businesses not on the marketplace, okay, there's still all the plans that are offered just like they have been in the last however many years, you know, the separate small business market, all right, they all have to include these essential health benefits. So moving forward, the competition is going to be based on price and quality of the plan rather than the benefits. And there's some major upsides to that because as an employer in the past, as an individual or as an employer, it's been really, really hard to make any decisions about a plan because you'd be comparing apples to oranges or apples to orangutans because you couldn't tell what benefits were included. So moving forward, that's going to be very standardized, and you can just look at price, quality, provider, network, etc. All right, and small business owners control the coverage offered to employees. So as a small business owner, you can go onto the SHOP marketplace and you can say, okay, I like this plan and I want to offer this plan to my employees. And you can decide if and how much you want to pay toward your employees' premium. So you can just offer them the coverage and not pay anything, or you can choose to pay, you know, 30% of their premium or pay a portion of their premium as many large employers do. I have a question here. What if the current health insurance charges are different for men than women? Can a small business still offer the same insurance? That's a really good question, and the answer is likely a no. So there are some plans that are quote-unquote grandfathered. So plans had the potential of being grandfathered until they make sufficient changes that they lose their grandfathered status. Okay? So that's a really good question if you call your broker, your agent, or if you call your health insurer. As soon as that plan makes enough changes in benefit structure or price or premium, they will lose their grandfathered status, and no more will they be able to offer men and women different prices. There are very few grandfathered plans, so I'd be surprised if yours was, but it's possible. So I would look into that, but we're moving toward a direction where all plans will not be able to do that. Good question. Thank you. All right. And again, you may qualify for tax credits to offset your costs of providing insurance to your employees. Moving forward, you can only get this if you get your insurance through the SHOP. The last 3 years, you could get this tax credit if you offered insurance to them at all and if you paid half of their premium. Okay, we're going to talk more about the tax credit, but there's a shift. It used to be the last 3 years, they had a tax credit for small businesses if you provided any kind of insurance to your employees. Now it's only SHOP insurance, okay? All right, so here's a little diagram that we can follow. Does my business qualify to use the SHOP exchange? Well, ask yourself, do you employ at least one person other than yourself? If you don't, you are self-employed, you have no employees, and you can go to the individual marketplace to get coverage and to access financial assistance, or as we talked about, you can go to, if you're income eligible, you can go to BadgerCare and get coverage that way, but you cannot use the SHOP exchange. Do you employ 50 or fewer full-time equivalent employees? So that means that it's 30 hours per week, again, is a full-time equivalent employee. Okay, so you take all of the average hours of your employees and you divide it by 30 hours, and that's how you determine how many employees you have. And there are, if you Google this, there are all sorts of calculators on the website that can help you determine that. So if you do employ 50 or fewer, your business is eligible for the SHOP exchange. You can enroll directly through the SHOP at healthcare.gov, or you can still go through your insurance broker. Totally legitimate to still go through an agent. If you get insurance through the SHOP, this is important to note, you have to offer it to all employees who work 30 hours or more, 30 hours per week or more, okay? So you cannot just offer it to your employees who work what many of us think of as full-time, which is 40 hours a week. You have to offer it to all of them that work 30 or more. Do you employ 50 or fewer full-time equivalent employees? No, no, no. I employ way more than that. Or I employ 51 employees. Okay. Then you are subject to what's called the employer shared responsibility payment. Okay. If you have 50 or more full-time equivalent employees, you should talk to your tax preparation people, your insurance broker, to determine whether or not you want to offer insurance or if you want to pay the tax penalty for not offering insurance. And I'll show you a different flow chart for that in just a second. All right, so here is the good stuff. Do I qualify for a tax credit? All right, let's cross our fingers and hope that we do. So the number one qualification is you can be either a nonprofit or a for-profit business. So this is a common misconception. Often nonprofit businesses think that they don't qualify, but they do. They actually qualify if they get slightly less in terms of what they receive back in tax credits, but they do qualify. To be eligible for a tax credit, you have to have fewer than 25 full-time equivalent employees. Except, just to make things interesting, they decided that for the purposes of the tax credit, full-time equals 40 hours per week. Okay? So just keep that in mind when you're doing some calculations. And again, there's some good resources on the web for making these calculations. And of course, you can talk to any of your tax preparation specialists or your broker and agent. In 2014, this changes to 50 employees, or 2015, excuse me, changes to 50 employees. You have to pay at least 50% of your employees' premiums. Okay? So you have to cover at least half of their premium or you're not eligible for the tax credit. And this is one that, you know, I work at a nonprofit now, all right, and we're fewer than 25 full-time equivalent employees, but the average wages are just barely above $50,000, so we're not eligible for the tax credit. So often this is one that gets people. The average wage has to be lower than $50,000. And beginning in 2014, so beginning right now, these tax credits are only available for plans purchased through the shop exchange. Okay, once again. And here's a good resource for you in general. You'll see down here the Wisconsin Business Alliance. I encourage you to write that one down, wisconsinbusinessalliance.com. They have some great resources, and there's a tax credit calculator where you can put in some information about your business, just some numbers about employees and average wages and stuff like that, and it'll help you kind of look at the numbers to make some decisions about what's right for your business. We have a question here. Individuals must go to the marketplace by March 15th to start coverage by April 1st. Yes, absolutely. Unless they have a qualifying life event, absolutely. Is this the same for small businesses, or can they go to the marketplace and start providing insurance to their employees at any time? So great question. I'm going to follow up on that just to make sure. I don't want to give you the wrong answer. My understanding at this point is that they can, small businesses can sign up for coverage at any time and offer it to their employees at any time. But I'm going to follow up and get an answer to Andrea on that just to make sure that we have the right answer. And to be honest, things change often. As I said, they release rules and regulations every day, so I want to find the most up-to-date answer on that. But it would be really good to have a timeline for you guys. Let me write that down quickly. All right. So I hope you all wrote down the Wisconsin Business Alliance, because that's a great resource for you. All right, so here's a good one. So this is for large employers. So this is for more than 50 employees, okay, or at least 50 employees, so 50 or more. So that what's weird is that if you have exactly 50 employees, you are both eligible for the shop, but also subject to the penalty, okay, because it's government and it's complicated, and I'm sorry about that. All right, but so here we go. So here we start over here, and then we say, do you have at least 50 full-time equivalent employees? And remember, we're using 30 hours per week here. If we have fewer, nope. Then we say no penalty for small businesses. So once again, this is something that I hear sometimes. Like I've heard small business owners say, oh, I have to close my shutters because of the Affordable Care Act. And that's really confusing to me because they are not required to change a thing, okay? That you can not offer coverage, you can choose to go through the shop, you can choose to not go through the shop exchange, whatever you want. If you have 50 or more, let's check out what happens. Do you offer coverage? No, we don't offer coverage. Okay, well that means that your employees, this FFM stands for Federally Facilitated Marketplace, so they can go to the marketplace to buy coverage and they're eligible for a subsidy. Remember, because if your employer doesn't offer coverage, you can get that financial assistance. All right. If your employees do that, okay, so did that happen? Yes, it did. Then as a company, you pay $2,000 per full-time equivalent employee minus the first 30 employees. I know. It's a little complicated, makes your brain melt a little bit. But for instance, Walgreens decided that they were not going to offer coverage to their employees anymore. Okay? So they said, are we going to offer coverage? No, we're not. And then they said, we're going to send all of our employees to the marketplace where they can get a subsidy, and then we're just going to pay the penalty for them. And Walgreens is just an example where instead of offering them insurance, they chose to offer them some additional income to make up for the amount that they're not offering in health insurance. So those people are getting a little bit of money from Walgreens toward their health insurance. They're getting some financial assistance if they're income eligible from the marketplace. And to offset the money that they're getting from the government, okay, Walgreens is going to pay a lot. You can imagine how many employees Walgreens has, right? So after the first 30 employees, which is like one Walgreens store, right, they're going to have to pay $2,000 per employee after that, okay? So let's go back here. Do you have a big company? Yes, I do. Do you offer coverage? Well, yes, I do. All right. Does your coverage pay for at least 60% of health expenses? Remember, that's that minimum essential coverage, that bronze level plan that we talked about. And does every employee pay less than 9.5% of family income for their coverage? So is it affordable? Oh, crap. No, I actually offer really crappy insurance or really expensive insurance. And that means that those employees, your employees, can once again go to the federally facilitated marketplace and get coverage and be eligible for a subsidy. Okay, well, did that happen? Yes, it did. So if that happened, you have to pay $3,000 penalty for each employee receiving a subsidy, okay, up to the amount that you would pay if you were subject to this. So the point here is they're like, well done for offering something, but you still have to pay a penalty because the something you're offering is not that good. But you're not going to have to pay more than if you were offering nothing. Okay? A little mind melting, but hopefully you're following along here. And then once again, do you offer coverage? Yes, I do. Is it adequate? Yes. Is it affordable? Yes. Well done. No penalty for you. You win the prize. Okay? That's large businesses. Whew. Okay. Any questions there for small businesses, for large businesses? We're going to pause here for just a moment. Here's a question. Let's say an employer with more than 50 full-time equivalent employees offered emergency coverage only. Would they be penalized, or does this type of insurance no longer exist? Is that penalty per year? So yes, that's a penalty per year. Good question. And for large employers. And if they offered emergency-only coverage, it's really rare these days that you see that sort of coverage offered by large employers. But if they did offer that, they would be penalized because it does not meet that adequate 60% rule. So it's not considered minimum essential coverage, so they would be penalized. Good question. Any other questions about small businesses, the tax credits, anything like that? All right, we're going to see if we can pull it all together here. All right, so I wanted to just show you this. So this is primarily for individuals, okay? And this is for those that do not have access to employer-sponsored insurance that's both affordable and adequate. I can't believe how many times I've said those words today, but they're really, really important as you see. So this is for people who do not have that employer coverage option. So this is just to show you, this is what's available in Wisconsin. So parents and caretakers and childless adults are eligible for BadgerCare up to 100% of the federal poverty level. After that, they can go to the marketplace and they can get a tax credit for, that's that premium tax credit, that premium subsidy, and they can get that cost sharing subsidy up to 250% of the poverty level. After that, they can go to the marketplace and get coverage and also get that premium tax credit up to 400%. And after that point, anybody, it doesn't matter your income, can go to the marketplace and not get a tax credit. Even if your employer offers, insurance, but you just don't like that insurance, even if it meets that affordable and adequate test, you can still choose to not take your employer's insurance, and you can choose to go to the marketplace and get insurance there. You just wouldn't be eligible for the tax credit, okay? So for children and pregnant women are eligible for BadgerCare up to 300%, and then after that, they can go to the marketplace and get a tax credit up to 400%, all right? Over here, I just want to point out, this is family planning only services. So this is not considered minimum essential coverage because, again, this is just like a one service only type of insurance rather than a, just like emergency insurance, okay? But this insurance is specifically to help with women so that they can access contraceptive coverage and pap smears and cervical cancer screenings. So the elderly, blind, and disabled coverage here is there's no changes there, okay? So if you know anything about that, don't worry about it. We have a question here. If you are on if you're on federal birth control assistance program, will you have to pay for insurance? I'm not sure exactly what you mean by federal birth control assistance program. You might mean that this family planning only service, and maybe I answered your question already, but regardless, if you are only covered for birth control assistance, that's not going to count as minimum essential coverage, and yes, you would have to get separate coverage or face a penalty or qualify for one of the coverage exemptions. Okay, we have a question here. Do large businesses have to begin changing insurance or accepting the penalty in 2014, or is it delayed to 2015? Oh, Michelle, you are wonderful, and it's amazing to me that you know that, but yes, it's delayed till 2015, okay? Good question. All right, so this is for individuals, so let's see if we can go through a little flow chart here, and this is everybody. Okay, so don't get scared. Don't get scared by this. So the blue stuff is the only new stuff. Everything that's in black already exists. Everything that's in black is everything you already know, okay? So up here, this is that exempt population, you know, if you're incarcerated or not legally present, or if you have a hardship exemption or a low-income exemption, you don't have to have insurance. There's also going to be a population of people that just continue to choose to be uninsured, even though they're not exempt, and just pay the penalty, right? Because this first year, as I said before, if you're a single person and make $50,000, the penalty is $400, but for most people that's cheaper than a year's worth of insurance, right? So there are going to be some people who just choose to be uninsured. But for everybody else who's going to be insured, there are two main paths, government and private, all right? So if we're going through the government path, there's TRICARE, which is Veterans Assistance here, and the VA care. There's also Medicare, which as we talked about before is not changing basically at all. And then Medicaid is changing just slightly because we're altering the income level. So basically, if you make less than 100% of the federal poverty level, you can go on to Medicare. Once you get one of these, you go to your insured product, meaning you get on your HMO or your PPO or whatever. Don't worry about what these mean. This is your insurer, right? Physicians Plus or Group Health Cooperative or Dean Health or whatever it might be. And that's how you get to the doctor, right? Or you'll see this line up here. If you're uninsured, obviously uninsured people still go to the doctor, right? But those people are just going to pay a lot of money for it, okay? All right, and so if you're insured and you aren't eligible for government coverage, you're going to go through private coverage. So your first option here is still individual and self-employed. So if you do not have a coverage from a large employer or a small employer, you fall into this individual or self-employed group. You still have what your option is now, this black line. So this is me. I fall into this individual category, okay, because I'm a contractor, so for several nonprofits. So I just went straight to Physicians Plus and signed up for my coverage, and that's how I access the doctor, okay? Moving forward, I will have the option. I can either do that still, or I can check out my options on healthcare.gov, and I might qualify for some financial assistance. I can choose a plan there and then get to my provider, okay? So this is just an option. I can still do that thing I've been doing, okay? If you are a small business, 1 to 50 full-time equivalent employees, once again, you can do the same thing that is available now, which is you can go straight to your insurer and set up a plan for your small businesses, and then they can go to the doctor. Or you now have this new option of going to healthcare.gov, checking out your options on the shop marketplace. Maybe you're eligible for a tax credit, and then you choose your plan here, and then that's how your employees can get to the doctor, okay? And then for private coverage, these are the large group plans, 50 or more full-time equivalent employees. Some of these plans, like AT&T, for instance, they're so big that they decided to take out the middleman and they self-insure, okay? And so they have such a large population that they don't need to spread the risk, and they take on the risk themselves, and then their employees can go to the doctor that way, okay? So you basically have like AT&T health insurance, all right? So large groups who don't self-insure, okay, they go here and they choose their plan. So they don't have access to this shop marketplace, but they can still go through an agent or broker and they choose their plan and then go to the doctor. So this grandfathered plans thing has come up a couple times. There are still going to be some grandfathered plans for probably the next year or two, but those are going to slowly subside over time because they lose their grandfathered status as soon as they make sufficient changes to the plan, okay? So a couple questions here. If you are going to offer insurance through the shop and only 2 out of 20 employees take it, are you still eligible for the tax credit? That's my understanding, is that you are still eligible for the tax credit as long as you offer 50% of the employee's premium. Okay. Someone asked, will you be providing questions and answers at a later time? Feel free to ask at any time. I'm answering questions now, so type them in.
Well, and Sheila, we won't be offering a transcribed Q&A. It will just be available if we're able to post the archived webinar on our website.
Yeah. And I'm going to send some follow-up to Andrea as well. All right. Somebody says, is there someone in Eau Claire that can sit down and go over insurance and stuff with us? Such a good question. So I would refer you to hold on, let me see can I access the web here?
Mm-hmm. But you got to minimize it, I think.
Okay. I'm going to see if I can show you this website. Yeah. All right. Well, write this down. www.e4health.wi.org. www.e4health.wi.org. Check that out. That's a local resource. If you go to the tab that says For Consumers, there's a link there where you can look at all of the available assistance in your area. So you can go to your county and you can see who's doing enrollment assistance in your area. There are special enrollment assisters. They're called Certified Application Counselors, and they are more than happy, and they're totally free, and they are unbiased, and they will not tell you which path to take or which plan to choose, but they will help go through your numbers and help you kind of understand and talk through it so that you can make the best decision for you and your business. What is the benefit for an employer to offer insurance but not pay any part of the premium? Doesn't that just block some people from getting tax benefits? Such a good question. So it wouldn't, I mean, an employer can choose to do that, but it wouldn't necessarily block people from benefits unless the premium was really cheap, because remember, they have to have that premium be affordable. So unless the employer, so if the employer doesn't pay any portion of that premium, it's likely that the premium might be deemed unaffordable, and then they would still be eligible for premium tax credits on the marketplace. All right, so let's wrap this up here. So what do I need moving forward? All right, number one, to get organized, I recommend pulling together the following stuff. Number one, your employer ID, okay? Number two, your tax ID. Number three, a list of all of your employees. Number four, your employees' birth dates if you are thinking about offering insurance. And your health insurance budget. So, you know, and you can kind of talk this through if you're going through your information with somebody who's going to help you. But your health insurance budget, knowing what you really can realistically offer per month will help you out. And lastly, a target start date for offering coverage if you want to go that route for your employees. And so now what do I do? All right, so the first step would be to determine whether you are self-employed, a small business owner, or a large employer. Okay, we talked through a lot of that. Hopefully you were able to figure that out. Secondly, you want to determine whether or not you're eligible for a small business tax credit. Okay, and again, there are some great websites available for that. If you go through an insurer or a broker, they can help you with that as well, or your tax preparer. Third, decide if you want to offer coverage for your employees, and if you already do, make sure you still want the option that you have, and you might want to check out the shop exchange to see if there are better options that you might like more, and make sure that if you're eligible for tax credit that you are getting it, because if you're getting, if you're getting your plan and didn't go through the shop, it's possible you wouldn't get your tax credit when you deserve it. All right, and then lastly, of course, make the right choice for your business. If you're a small business and it would break the bank to offer coverage, just don't offer coverage, okay? Your employees have other options. They can go through BadgerCare, they can go through the marketplace. This is just an opportunity for small businesses. You are not required to offer coverage, as we've talked about, so make the right choice for you. And then lastly, this is my information here. I'm sorry to tell you that I'm actually leaving my role at the end of the month to do some traveling internationally, but feel free through January to email or call me anytime. After that, feel free, please, to go to WCCF.org or call WCCF, the Wisconsin Council on Children and Families here. And we are very, very passionate about helping you all get access to coverage and get answers to questions that you have. So please, if you have any follow-up questions, I'm happy to answer them now. And I really appreciate all of you coming today. And again, a big thank you to Wika for hosting this. And I hope you guys got something out of it. I think you're going to get a follow-up survey to ask you what you thought. And it would mean a lot if you could fill that out for us. So I'm just going to answer a few questions here. Feel free to stay on, get your questions answered as needed. Here's a question. So we as childcare in-home family providers do not qualify for any tax credit, although this is our small business. Not sure I understand your question. Do you understand?
Because you don't have employees, do you mean?
Do you mean because you're self-insured? Okay, yeah. So you cannot go if you're self-insured and you are an in-home family provider. You cannot go get small business coverage. But I actually think you kind of have a better option, which is going to healthcare.gov just as an individual, and then you, depending on your income, would have access to the financial assistance that's available for individuals. So you actually might get a better deal by going through the marketplace as opposed to going trying to get a small business tax credit. Any wrap-up questions here? Any final questions? All right. Well, I will just say thank you, and once again, please feel free to follow up with me and give Andrea and Wika any feedback you have, and we so appreciate it. Thank you very much.